Hi, here we are at video 4 of 7, where we are in the diagnostic phase of Inquire. As in the provider ecosystem, there are a lot of different factors that influence provider behavior. And in this toolkit, 5 have been selected. Community influencing factor, client influencing factor cards, provider and colleagues, workplace environment, and health system influencing factor cards. Each one has a slide deck, a front and a back, and I'll walk you through those now. The first area, community influencing factor, you'll see the front of the card has the influencing factor and the back of the card has the definition. There's about 8 or 9 in each of the influencing factor decks of 5. But you can make new ones as you see fit, and I'll show you some of those later on. Here is an example of the client influencing factor cards, an example of the provider and colleagues. Again, these are color-coded. You might want to laminate them so they don't get destroyed, but I used double-sided sticky tape to put them together, and they lasted a while. Here's workplace environment and another example. And then lastly, health system. And you'll use these in the next phase that we'll go through, next tool, that we'll go through within this phase. These are additional influencing factors that were discovered in Sudan and South Sudan when we went through the orientation and the roadmap. So you'll see that the teams highlighted gender-based violence, outbreaks, shocks or stresses, limited family community cohesion, and then staff welfare, conflict and security and political instability, and turnover or strikes among health staff. So for you, and your discussion is, do all these adaptations apply to your setting, or do they not apply at all? Do you need to make new adaptations for your influencing cards, and what's missing? And that's for you to decide. You adapt as necessary. So again, we've gone through prepare, and we are in the inquiry stage. And we are going to start using those influencer cards with the next handouts we will go through in the video. So now we're in data collection. Why do we collect all this data? It helps us really understand what shapes behavior, and it includes providers, clients, and other stakeholders for a participatory and inclusive approach. As mentioned earlier, it has a strong focus on empathy, ownership, and it helps create buy-in among participants. Here we have 4 handouts that you will receive: a behavioral blueprint for providers, a behavioral blueprint for health district officers, a client scenario tool, and an observation guide for guided visits. In fragile settings, you might want to consider behaviors that may be more common than stable environments, such as gender bias. So just keep in mind as you're starting to go through this data collection, if you are in fragile settings, there may be other discussions or probing for fragile settings. So behavioral blueprints help the participants understand how influencing factors affect or impact provider behavior. As mentioned, we have a behavioral blueprint for the health officers, and we have one for the health providers. The influencing factor cards that we mentioned earlier are used at this time to facilitate the discussion. And you'll see here that there's questions that you will ask, and here is where, when you're talking about a behavior, you will put the influencing factor here, one that's influencing in a positive way, enabling, and one that's preventing in a negative way. And these will help you guide you through answering these questions with the health officers and the health providers. The client visual scenarios let clients review images that represent service provision, and then a member of the core implementation team talks to them about their recent experiences and their perceptions of service, delivery and experiences, how the provider behaved with them, and why they actually were motivated to seek that health service. Again, it's up to you. You can have 3 to 4 clients that meet certain selection criteria, and that will be based on the technical area that you're working on. The scenarios in the toolkit do include health literacy, norms, and misconceptions. And there's a blank one so that you can fill out another scenario that you would possibly want. For fragile settings, you might want to consider scenarios that focus on gender norms and harmful practices, or that impact the clients and the health providers' behaviors. Also, you might want to consider young women looking for family planning support during times of recurring stresses such as flooding or shocks and infectious disease outbreaks, and having to go through different providers and being turned down because of a lack of providers, attending to other priorities, or providers fear being infected. So really thinking through in fragile settings, what are the shocks and stresses that may affect providers and how that affects the client. Here's an example of a client scenario picture from the manual. And again, you'll take your own pictures for this scenario setting with your clients. The observational guide for the guided visit helps to give an overview of the workplace environment. It's helpful to check in with the M&E team because some of this data may already be collected through a health facility assessment or a service provision assessment or other data that's been collected at the health facility. You can review the outstanding questions with the facility in charge or someone else that's the designee. In fragile settings, you want to make sure that you're capturing elements and adapt this accordingly. For example, are there private rooms available for GBV cases? Is there a referral system in place for GBV cases? Are boys and girls treated differently? What about ethnic minorities or vulnerable groups? So the last handout is the observation guide for guided visits. There are 6 steps and they can be condensed based on the information that's already available from the last slide that I talked about. You can take pictures with consent and remember that adaptation is perfectly fine, especially in fragile settings. In fragile settings, in that first step, when asking general conditions about the facility, you might want to think about conditions for the safety of the staff and clients under different crisis scenarios. In step 5 in fragile settings, when asking about facilities' performance in the region, you might want to probe if the situation will be the same under an acute crisis. So now we've finished the inquiry here, and we will move on to synthesis.